I am Dr. Bill, chiropractic kids and families. Welcome to this video presentation this morning. It is on chiropractic and babies. Happen to have one handy, so we're going to use little Mr. I don't know what his name is actually. Called Alfred. Little Alfred. We're going to use Alfred this morning to demonstrate a few things. Talk about why chiropractic and babies. So that's the point. That's the subject. And why would a baby need to be checked by a chiropractor? So I'll tell my story that I've told a few times, but way back when I was 21 years old, my sister was working for a chiropractor and I didn't know anything about it. And I had just finished serving a LDS mission in Italy, came back to my hometown of Waterville. She said, "Bill, this is awesome. You're going to be a chiropractor. It's going to be great." And I said, "I don't even know what that means. I don't know what they do." And I'd never really even heard of them before. So sure enough, somehow she convinced me to go to a workshop. I go to this workshop, figuring it was going to be about backs and necks and car accidents and that kind of stuff. And instead, he worked on a baby that had colic. He worked on a 2-year-old that had ear infections and an older kid, 9 or 10, that had digestive stuff. I didn't know what he was doing, but it was amazing, and I was hooked. I said, how on earth can what he be doing that the kids seemed to like, that was very gentle, how can that benefit the children? Talked to him afterwards, changed my major out here in Utah at BYU, finished up my undergrad stuff to go to Davenport, Iowa to become a chiropractor. And the rest is history, and I've been doing this now for 38 years. I entered school when I was 10, it was very precocious. Anyway, so that's the story, and that's how I got hooked. It was before I had kids. I ended up having 6 of my own, and now we have 12 grandchildren. So children have been a part of my life, but they weren't at that point. It just really appealed to me. Wow, this is a way to impact a little baby to a toddler to a teenager to an adult in a very positive way. So we're going to talk about how and why. Okay, babies come into the world when somebody gets pregnant. Pregnancy in and of itself is obviously a huge challenge. We're seeing several pregnant women right now from just barely in the first trimester to 35, 36, 37 weeks. Just had a baby come in yesterday who was 3.5 days old, whose mom went full term and then a little extra. So we check out babies. We also check out pregnant women along the way. So in utero, can anything happen? Can anything be a challenge to the baby in utero? Well, anyone that really has thought about that much knows the answer to that, and the answer is yes. So the baby even is in a perfect position and everything is absolutely right, baby's head down, facing anterior, which is forward, the way everything's supposed to be, then even that, you think about it, not a very big space in there. Not a very big space in here for little baby to be hanging out. So then you can also have challenges. I don't know how you can see this picture. It's kind of an old picture, but this is showing a correct position. This is the baby's not exactly where it ought to be. That doesn't look very good. That's breech. The one they don't show is transverse, which is sideways. So any variation thereof can cause lots of challenges and problems. So one of the things that chiropractors do is something called the Webster technique. So we're going to talk about the Webster technique for a few minutes. I'm going to use the baby here, even though pretend this is a pregnant mom. And the two things that we do a leg length check. We see how flexible the legs are. In fact, even the baby can see it. This leg's less, maybe this baby needs an adjustment. This leg is not flexing up as far as it should. And we also raise the leg and see which one can raise better. And in this baby's case, it would be this leg that doesn't raise as well, which would bring us to the SI joint on this side right here. We would use a little clicky thing called an activator, and we would do hands-on. We wouldn't do any pushing because obviously the baby's in front, but we would do trigger point work here, and we work on the posterior ligament, means from behind, on the sacrum that attaches to the uterus from behind. So that's step one. Step two, you gently help mommy turn over And now, here we are. This is not a mommy, I understand that. The round ligament, which every mother who's been pregnant knows what that feels like, just underneath the little cusp here. I'm gonna go back to that picture before. So right about in here, right underneath the curve of the abdomen, the belly where the baby is, the uterus, there would be another point right there, right about where her thumb is, actually a little bit over this way. There's a little point there. Again, very gentle pressure applied, put up underneath here, and that actually helps release and relax the ligament. Why is that important? You want relaxed ligaments so that the baby can get in the right position. So that's what a chiropractor does. Works here, then the opposite side, so it could be the other way, it could be there and on this side. But anyway, that's where it starts. Webster Techniques then relaxes those ligaments. I personally I've helped well over 100 to 125 babies turn in the right direction. So then what happens, the baby gets in the wrong position, and by relaxing the ligaments, it helps the baby turn naturally. So, going to the next part. How easy is it for a baby to be born? I think that anyone that's been through the process knows that it's not that easy. If you take a look here, we have baby inside, undilated cervix, starts to dilate, gets to 10 centimeters. The baby has to come out, and it's quite a process. Baby's head is much bigger than the normal opening is, so obviously the vagina has to relax and stretch a great deal. Would recommend there's a bunch of ways to help do that. We love midwives. I think they're awesome because they help in a very natural way, not against the OBGYNs of the world, but the midwives and doulas seem to be way more natural, way more oriented to helping the mom in a very natural way. So, under the best of circumstances, baby's got to come out, the baby comes out, baby's got to turn, and obviously umbilical cord and so forth, and the placenta. So, pretty tough. Now here's the baby coming out, the head turns, there's tons of pressure on the cranium. That's why there's a soft spot here and also in the back there that stays there actually for 6 months to a year or even beyond, so that the cranium can actually fold in on itself during the delivery. And then think about the amount of pressure here on the neck. I looked up videos of delivery to see if I could share a little snippet of one. Didn't find any that were terribly appropriate. We did watch some at chiropractic school. I had a bunch of educational videos that had some on. Pretty brutal. The midwife generally is pretty gentle. Hopefully most OBGYNs are, but they can cause pressure. They can use forceps in case the baby gets stuck, and then they can also use a vacuum extractor, which can cause damage and a lot of pressure. So under the best of circumstances, getting born is pretty dang tough. The beauty of bringing a baby into a chiropractor is that, okay, I'll take a backstep. Traumatic birth syndrome, term that's used a lot. If you look it up in the literature, there's lots of different, some of them refer to the post-traumatic syndrome for the mother having the birth, but we're talking about the baby. So, a lot of pressure on the baby's cranium and neck. Just think about that. Think about the twisting, the pressure coming out. The baby's neck has been in utero, suspended in a fluid-like sac. And then all of a sudden, if there's any yanking, pulling, twisting, can definitely cause subluxations. Baby's head goes through a narrow canal. I already talked about that part. The fontanelles are just called the soft spots. Anterior and posterior. Anterior is here, posterior is back there. According to research done in the 80s by a man named Gutmann, who was a German doctor, he found that 80-90% of all babies have upper cervical subluxations, which means a misaligned vertebra is out of position and the body can't replace it. And you think about it, of course, how many babies come out and are not in need of some kind of a little bit of help? Out of the thousands of babies that I have adjusted from day 1 to 14, 24, whatever, in the first few months of life, very few didn't need any kind of help at all. There was one recently that came in, a great little family that comes in. It was their 4th child, and I forget the term, but in essence, the baby was born and stayed inside her sac the whole time. a mermaid type delivery. There's another official word, I should have looked it up, but I can't remember what it was. She actually had as little going on initially as anyone that I've ever seen, because she was so protected through the whole thing. So if you can figure out how to keep your baby in the sack all the way out, it's extra protection. So I don't know how to do that, but it's just a thought. Anyway, definitely babies need a lot of help. I thought I just wanted to jump ahead here. I really like this picture. I'm going to go back. Very, very gentle what we do chiropractically for babies. We do not pull, yank, twist, any of that. We do mostly craniosacral work, which I'm going to go back to, but I just thought that was a perfect little picture. So here we go back. My 38 years as a pediatric chiropractor, the most common symptoms: colic. Baby screaming for 3 hours or more without an apparent cause. That's not fun for anybody. Not for a baby, for mommy, daddy, siblings. It's rough. And that's the number one reason why I love to see babies, to help them with that. Reflux. They're not able to keep the food down because there's too much pressure on that esophageal stomach sphincter, and it just causes from minor to major eruptions. Constipation. Everybody's got to poop. Whether you're 1 day old or 100 years old, you got to poop every day, and we find ways to help that baby do that. Inability to sleep well at night. Nobody likes a crying baby. Babies do cry sometimes just to communicate, and that's okay. They're hungry, they need to be changed, they're a little tired. But when they're crying because their tummy hurts, they're not sleeping well, that's not cool. All right, so quick education here. Parasympathetic versus sympathetic. Sympathetic is the fight or flight. Let's get ready, let's go. We've got a crisis, we got to get out of the room fast. It's the stress syndrome. Everything pumps up the volume. Increased breathing, increased heart rate, increased I'm ready to go, let's go. Babies that come to see me with colic, reflux, etc., they're in this state. What we do is help calm things down with the parasympathetic, which is the rest and digest. I have my own version of this here. Rest and digest, you see, when you stimulate parasympathetic, it helps to the digestion, it helps the resting. When you stimulate sympathetic, it gets things done, it's under a stress state. What I want to show here is this particular graph, and if you look carefully, sympathetic is represented by the yellow, parasympathetic by the green, that's sacrum and cranium. We do a lot of craniosacral, gentle, easy work with babies. They love it. We teach parents how to do things themselves. We had a mom come in this last week with a baby with a little bit of a flat spot. We're helping get the neck more balanced, trying to get the muscles to calm down, and reshaping of the head. We do hold babies upside down. That is something that we do. If you look at my video, we do that, and that actually helps reshape as well. We encourage only mom and dad to do that, not any of the kiddos, however old they may be. And this actually helps reshaping. I have a grandson who had a hematoma because he got stuck in the birth canal, and the reshaping totally helped everything do what it was supposed to do. So chiropractic can help in a very gentle, easy way. Again, I got so many stories. I'm going to tell just a couple. Colicky kids, I have had hundreds of colicky kids. One of my favorite stories is a baby came in, she was 3 months old, very unhappy. She looked exhausted, mom looked exhausted. We did the craniosacral, we did the little treatment, and the mom said that when the baby girl went home, that she fell asleep with her arms up above her head like that for the first time in her life and conked out for 4 hours. Love that story. Projectile vomiting. I had a young mom, first kid came in, she said, this is not what I thought it was going to be. Had a huge bag, 3 chains of clothes for mom, 3 chains of clothes for the baby, and the kid, I said, I was in my brain, I said, she probably exaggerating. Well, right in front of me, boom, up chucks, and it just, within 1 month's time, no more big bag, no more projectile vomiting, no more projectile reflux, everything calmed down. Baby couldn't eat dairy or soy, they had to do a lot of work. When they ate dairy, they got terrible reflux. When they had soy, they had diaper rash. I ended up going into goat's milk with that baby, and he's now a year old, and he's fantastic. Just saw him this week. I love that. Makes goosebumps on my hands. Ear infections work, not sleeping, not pooping. We do something called helping the poop shoot. Not driving, flat spots on head, I already talked about, and on and on and on. I love babies. If I could just adjust babies all day long, then I love other people too, but there's just something about babies. They don't deserve to be sick. They don't deserve to have problems. So therefore, I've always been committed for all these years to help babies. Okay, we're gonna give a little call to action offer here. If you're watching this video, if you've stayed on this long, we will invite any baby you know of any way, shape, sort of form. Could be a day old, could be several months old. We will let them come in for a complimentary baby's exam within 2 weeks of this video. Today is August the 4th. So send them in. Let's get them checked and see how we can help. We'll do the exam, tell them about subluxations. The baby's parents can decide what they do want to do or don't want to do. But let's get them in here. You can ask anybody that knows me. I love babies. We love babies here in this office. My son, Dr. Daniel, is learning how to help work with babies. It's the most pure part of chiropractic, in my opinion, and I totally love it. Hope that you will refer some people in so we can get them helped. We'll do the exam at no charge, and the rest is up to them. So, love you guys. Great talking to you, and let's do it for the babies.